will. So thank you so much, everyone, for being here. What a great group. Oh my gosh, I'm impressed to see so much interest in this really important topic. So my name is Sally Duplantier, and for the next 45 minutes, I will be talking about nutrition and bone health. And I think this is really a nice complement to the other presentations. So a little bit of a background. I am a gerontologist and a researcher, and I am a dog mom. And I was trying to take my dog next door, but it didn't work out. So you might hear her in the background. My research is focused on healthy aging, really across the lifespan. And I take very much of a lifestyle medicine approach. What are what is the role of nutrition, movement, sleep, stress, social engagement in promoting healthy aging? And I happen to be the co-chair of the Women's Healthy Aging Subcommittee for the American College of Lifestyle Medicine. I probably should have spelled that out. The reason I mention this is because our subcommittee has recently been working on patient-facing bone health materials, and I will be drawing on some of that research today. So, in terms of my background, I have a certificate in nutrition science from Stanford, a Master of Science in Gerontology from the University of Southern California, a graduate certificate in qualitative research from Indiana U, and wait, I just started a doctorate program. Oops, I'm a doctorate student. I'm a doctorate student in public health at Indiana University. And I will tell you that I will be 75 when I finish and get my doctorate, but I'll be 75 anyway. So why not? Why not? So I'm going to go over our agenda today, and I will be stopping to ask you some questions. I hope you type into the chat. I'll also save 10 minutes at the end for Q&A. However, if I say something just doesn't make sense, type it in the chat. I'll try to stay aware of it. But Roy, you can interrupt me if somebody has a burning question. So today we're going to talk about why bone health is so essential for aging well. I will describe guidelines for assessing bone health, 6 key nutrients that help maintain strong, healthy bones, 9 plant-based food sources that are rich in calcium, and then we will be talking about 2 effective strategies to improve calcium and vitamin D absorption. And as I mentioned, I'm going to be sharing this within a framework of lifestyle medicine to support bone health. Because yes, there are certainly medications that are very important, but here we're really looking at lifestyle. Now, I know that many of you already know some of this information, and that is great. But my goal today in 45 minutes is to give you at least one new idea that you can apply to your own bone health or to the patients or clients you serve. And I will be asking you at the end, what's one thing you learned? Okay, so a little bit of a grounding of the research. So when my subcommittee at ACLM started working on patient-facing bone health materials, there's a plethora of information. I mean, it's a broad topic. So our North Star, what we stayed grounded in, were guidelines from the Bone Health and Osteoporosis Foundation, which is really the nation's leading nonprofit dedicated to bone health, in much the same way that the Arthritis Foundation is focused on joint health. And BHOF has a publication that they use as their North Star. It's the Clinician's Guide to the Prevention and Treatment of Osteoporosis. So this was kind of our first source of information. I will tell you that the content of today's presentation is supplemented with 24 other papers, but this one is a really good, it's kind of like a good Bible or North Star. And so Roy, I sent you that link in advance. Maybe you can put it into the chat at some point. Okay, so what do we mean by bone health? Like let's have a common definition. So it's the strength, it's the structure and density of your bones. And bone health is essential for supporting your body, protecting your organs and your muscles, and anchoring muscles and storing minerals like calcium. And I think this is a really important concept. We think of calcium as important for strong bones. Yes, but bones are kind of the storehouse for calcium, and calcium does a lot more. Calcium is important for muscle contraction and hormone release and blood clotting and nerve regulation. And so if your body needs calcium for these other functions, it's going to steal it from your bones if there's not enough it is circulating in the blood. So this is important. And then healthy bones are dense and strong, making them less likely to break or fracture. And that's the real challenge as we get older. It's the fracture, it's the breaking of the bones. So I'm sure you've seen this picture. Normal bone, osteoporotic bone, dense, few holes. I mean, you can look at this bone structure and you can see why it may be very susceptible to fracture. So the difference between osteoporosis and osteopenia is osteoporosis is the more advanced form, a decrease in bone mass leading to fragility, loss of strength, and increased fracture risk, where osteopenia is a diagnosis that's on its way to osteoporosis. And ideally, if somebody has bone loss, we can catch it here before it progresses. So I think this graph is very, very important. I share this with a lot of my clients, and it has to do with when our bodies are bone building versus decline in bone. Now, granted, this talks about menopause and it has to do with women, but in men, the loss of testosterone also impacts bone density. It just starts to happen a little bit later. So in our, early years, in our teens, in our 20s, we have more bone building than bone breaking. These osteoblasts and osteoclasts continue to work with one another to help reform bone. There's a constant process, but it's kind of like the bone building is winning. And then by the time we get to our 30s, it evens out. And so you can kind of see that on the curve. So these are pretty much equal. Then when menopause hits, there begins to be a decline in the bone mass curve because there is a lot less bone building compared to the bone breaking. So what we would expect for a normal woman after menopause is that there's going to be some loss of bone mass. But what we are really trying to prevent is this curve, osteoporosis, which again is going to increase the risk of fracture. Okay, so how do we know? Because as you've heard, osteoporosis is a silent disease. You don't really know you have it. You may not know you have it until you fracture a bone. So you may have heard that DEXA scans are recommended. If you're an MD, you probably are already recommending these for patients, but it's by age and risk factor. And I work with a lot of women who think that they need to wait till age 65 for a DEXA scan, and that's simply not true. So these are the guidelines from the Leboff paper, the one I mentioned earlier. So you can see, yes, any women over 65, men at or over 70. But if you have a history of risk factors, you need to do it earlier. Low body weight is one. And I sure wish somebody had told me about this years ago. Family history of osteoporosis or fracture. Smoking is a big one. And then adults over 50 with a prior fracture, if you have fractures that are really kind of, like it was a simple fall or maybe even a fragility fracture, I mean, you probably are at risk for osteoporosis. And then there's certain conditions and medications. If you have rheumatoid arthritis, if you take glucocorticoids for COPD or asthma or certain types of cancer, then you're going to be at greater risk. And then this is one that I think we need to stress more to patients. It needs to be at the same facility and device year after year or every 2 years because all of these machines are calibrated differently. And if people go to different facilities, they're not going to be accurate and they need to be redone. Okay, so you've heard of T-scores. This is just a reminder. Our osteoporosis starts when a T-score is minus 2.5. And this is compared to a normal average 30-year-old. So again, the T-score is not normed for your age group. It's normed against a 30-year-old. And it's measured at the neck of the femur and at the lower lumbar spine. So why is this so important? Look at this statistic. 1 in 2 women and up to 1 in 4 men over age 50 will break a bone due to osteoporosis. So we're not just talking about the incidence of osteoporosis, we're talking about how many people break bones. And then why do fractures matter? The consequences can be severe. And one of the most frequent kinds of fractures is the hip fracture, because that neck of the femur, where the femur attaches to the rest of the body, where the leg attaches, it can be very, very narrow and porous as we get older. So after a first hip fracture, 40% of individuals can't walk independently. 80% can't even do daily activities like shopping independently. And 10 to 20% are going to require long-term nursing care. So there's serious impact. So one other tool that's being used quite frequently is a FRAX tool. You may have heard of it, you may be using it, but a FRAX tool is a good way to calculate your risk of fracture. So I do have osteoporosis, but I will tell you that my overall risk of fracture is pretty low because, for example, I don't smoke, I don't take glucocorticoids, I haven't had a previous fracture, but my height and weight do put me at greater risk. Okay, so now reducing risk. That was a little preamble. Again, that may be review for many of you. So there are many, many things we can do to reduce the risk of fracture. And reduce the risk of less dense bones. So these kind of go hand in hand. I'm going to be talking about nutrition today. But as important as nutrition is, it's important enough for a 45-minute talk, it doesn't stand alone. So it is important to also consider exercise. And I just love that so much of this summit has talked about exercise. And that's a combination. It's weight bearing. So that's walking, dancing, hopping, jogging, even stomping. It's strength training, body weight, resistance bands, um, dumbbells, machines, and balance. And all these work together. Um, Very simple. Don't smoke. I mean, I think we know that already, but smoking is one of the worst things you can do for your bones. Limiting alcohol is key. The Leboff study talks, and most studies talk about 3 or more drinks a day, but emerging research is showing that even 1 to 2 drinks a day can put your bones at risk. So limit alcohol. And then this is an area I think we don't talk enough about, and we need to. And I love that it's almost the emphasis of today's summit. The home modifications, the vision checks, walking with poles, additional work on balance, all the things that we need to do to prevent falls. So I am going to be talking about nutrition today. And, when we think of nutrition and bone health, we think of calcium. And calcium is super important. And I promise I'll get to calcium, but I'm not going to start there. Because what I really want people to understand is that many different nutrients are required for bone health. And so magnesium is one of these. It increases bone density. Magnesium, I feel like magnesium is like in the news a lot these days. Lots of people are talking about magnesium, but magnesium is in a lot of foods. So you can see it's in bananas, leafy greens, nuts, seeds, yogurt. You'll see the star of the show here is avocados because avocados contain so many nutrients. And one thing I advise my clients is to just have a quarter cup of nuts a day. Nuts and seeds are a great source of magnesium. It'll give you all the magnesium you need. And if you want something a little special, add some dark chocolate chips, because even dark chocolate chips have magnesium. And in a small amount, I think it's a great addition to nuts and seeds. Okay, vitamin D, we talk a lot about. Why vitamin D? Because it improves calcium absorption. It also improves phosphorus absorption. I don't have a separate slide on phosphorus, but it's also important for bone health. The challenge with vitamin D is that the best way to get it is through sunlight, and it's harder to get in foods. So it's in eggs, it's in salmon, it's in cheese, it's in fortified juice or milk. It's in mushrooms treated with ultraviolet light. But quite honestly, you would need to eat a lot of mushrooms to get all of the nutrients, all of the vitamin D you need. So this is a place I am not a big person on, like you need to supplement. This is one where most people supplement with vitamin D3. And like here in San Francisco, because we're above the 37th parallel, we couldn't even get enough sunlight in the short winter months. Okay, potassium. If you don't have enough potassium, it will deplete calcium in the bones. Again, lots and lots of places to get potassium. We know bananas, but it's in tomatoes, it's in beans, it's in dried fruits. There's the avocado. It's in salmon, nuts and seeds, sardines. Easy to get enough potassium. And then there's vitamin K. And we know the importance of vitamin K for many things. I do a lot of research on brain health. Vitamin K is very important, leafy greens. But for bone health, vitamin K synthesizes osteocalcin. So that is an important protein for maintaining bone health. And it's in the, again, leafy greens. There's my star of the show. Now, I'm also adding vitamin C. And again, I'm going here from the nutrients that are recommended by the Bone Health and Osteoporosis Foundation. Vitamin C is in colorful fruits and vegetables. You don't need to eat citrus. Citrus bothers some people. You can get it from colorful peppers. You can get it from pomegranates or berries. But it's critical for collagen production and overall bone quality. So collagen is like the scaffolding for our bones. And if we don't have sufficient collagen, it's like the scaffolding is not quite up to par. And that can lead to softer bones. So now I'm going to add one that you may not have heard of, and it's boron. And boron, you notice my references here. This is not necessarily one from the Bone Health Foundation, but it's one that's been getting a lot of attention recently. So I thought I'd throw that in again because many of you are very knowledgeable about this topic already. So boron is a trace mineral. And what's interesting with boron is that we don't even have an RDA for it. We have an upper limit. But you don't need much a day. It's 1 to 3 milligrams. And it's in pretty much all the foods we've talked about. It's in nuts, seeds, fruits, vegetables, whole grains, and legumes. So most of the research dating back to 87, but even as recently as 2020, is around boron supplementation. I am not saying let's all take boron supplements. I'm simply making you aware that boron is in a healthy diet. It's already there. And so I think this is my big takeaway from the first part of my talk is to eat variety, whether this is for yourself, your patients, your clients. And then again, that lifestyle medicine perspective is think mostly plants. I'm not vegan. I'm not vegetarian. I eat some fish. I eat some chicken, but I eat a lot of plants. And plants are providing most of the nutrients that I talked about so far. Okay, so what about calcium? Calcium is really, really important. But here's a challenge. When we think of calcium, we think of dairy. The Dairy Council certainly wants us to think of dairy. But here's a challenge. 75% of the Earth's population is lactose intolerant, which means that we don't have the enzyme to digest lactose. And so, like, dairy just doesn't agree with us. And so, we're going to do a poll. Roy, I think you have our poll, don't you, to show our poll? We're going to do a
Yes, ma'am.
poll of people here, and we're going to see if you are lactose intolerant.
Can everybody see
Take
that?
a second to
Good.
answer that. And we'll just do a little poll of people here. And then Roy will share our results. All right, let's see who responded, Roy.
Okay. For the first possible response for are you lactose intolerant? Yes, I can't eat any dairy. 10% responded to that.
Okay.
For the second possible response, somewhat dairy bothers me, 29% responded. And then for the third possible response, no, 61%.
Okay. All right. So about 1/3, 1 and 2 and 2/3. So what's interesting here is that those responses tell me something about your ancestry, believe it or not. I have a sense of where your ancestors are from. And I would say for the people who said no, you have some genetic ties somewhere in your lineage to Central or Northern Europe. So about 7,500 years ago, something interesting happened in Central Europe and it affects this idea of lactose intolerance. Go ahead and type in the chat. Take a guess. Who wants to guess what it might be? Any guesses? What happened in Europe? It can be a wild guess. Somebody, AC, said domestication of cows. I do love the not a clue or a disease outbreak, which are both very interesting. Yeah, you know what happened? Cows happened. We domesticated cows 7,500 years ago, which meant that dairy milk was now readily available. And what happened in people in Central Europe is they began to have a genetic mutation to allow them to digest lactase. Pretty interesting. But it would be problematic if 75% of the world's population is lactose intolerant if we could only get our calcium from dairy. So there are plenty of plant-based options for calcium, and I'm going to share a few of them. So first of all, we need 51 to 70 years. We need about 1,200 milligrams of calcium for women, and after age 70, it's the same for men. So can we get that without consuming dairy? Well, take a look at my menu here. So you can see that I've put together a menu of all plant-based options um, that allow us to get 1,200 milligrams of calcium. And I'm not going to read all of these. You can read them, but you can see that you have a nut-based yogurt, chia seeds, white beans. Any beans have calcium. White beans are especially good. Quinoa. The real winner here is kale salad. That's a good big takeaway. Eat kale. Uh, and so I want to take a look, though, at fortified non-dairy milk because they're not all created the same. But what do you notice here in the calcium department? What do you notice, for example, the difference between like an almond milk and a dairy milk? What do you notice about calcium? Anyone? Yeah, there's more. There's more calcium in these milks because they're fortified. There's less protein, however. And kind of the one exception is soy milk, which is pretty much the equivalent. Um, and I actually think soy milk is a good alternative. There's new studies coming out about it lowering cholesterol levels and especially circulating levels of LDL. So these these non-dairy milks can be a good option and a good way to get calcium. You may wonder, have heard about calcium absorption. So yeah, the challenge is that not all the calcium we consume, we absorb. And one of the big factors is age. So it's why the RDAs are set so high as we get older. But a couple others that interfere with calcium absorption are smoking and alcohol, which I've already mentioned. And I'm throwing in caffeine here, but I want to let you know that the studies are about people who are drinking 800 milligrams and more of caffeine. And if the general guideline is 400 milligrams of calcium a day, a couple cups of coffee, that is not a problem. I don't want people to be morbidly afraid of a cup of coffee. So here's one, though, that we need to consider is excessive oxalates and phytates. And so oxalates and phytates are compounds in plants that protect the plants from getting eaten. When we eat them, it doesn't impact our health, but it can make certain nutrients harder to digest. And oxalates are found in green leafy vegetables and legumes, and phytates are in grains. And let me just give you a real practical example here. So, spinach is high in calcium. A serving of spinach has 80 milligrams. And I hear a lot of people saying, oh, I get plenty of calcium from my spinach. But not really, because spinach is high in oxalates, which means low absorption. Now, it's also rich in vitamin K and other nutrients. Look at this, vitamin C, vitamin K, vitamin A. Eat spinach, but don't eat spinach because of the calcium. Better options for leafy greens or greens that are high absorption because of low oxalates are these. Kale is clearly the winner, but broccoli, bok choy, Brussels sprouts, cabbage, and arugula are all good options. And so, again, I think a central message today is eat variety. Okay, I'm going to conclude with this, and then I want to open it up for Q&A. Here's a paradox. Calcium absorption efficiency decreases as calcium increases. In other words, the more calcium you digest or take in at one time, the less you can absorb. So the best way to get your calcium is to get it throughout the day. So this doesn't make sense. Type in the chat. Why doesn't this make sense? Here's Nature's Bounty calcium supplement, 1,200 milligrams. It's all the calcium you need in one serving. What's wrong? Yeah, thank you. It's a large dose all at once. You could only absorb about 500, maybe 600 milligrams. So it's a waste. It's a waste for people to buy this. The general rule is to consume at least half your calcium from your diet. And that's in part because of some studies, which I will suggest are still inconclusive, but they say that supplementation more than 1,000 milligrams a day in conjunction with dietary calcium can increase the risk of heart attacks. So we're trying to keep supplements to around 500 milligrams. Now, the type of calcium that you ingest, the absorption makes a difference about if whether or not you are taking it on an empty stomach. So calcium carbonate, which is the most elemental calcium, it's the cheapest, it's the most readily available, it works with stomach acid. So if people are taking calcium carbonate on an empty stomach, that's a challenge. It's not going to be as absorbed. Calcium citrate, a little bit more expensive, but it can be taken on an empty stomach. And by the way, these are just generic pictures. I'm not recommending any brands. There's new types of calcium coming out. I would avoid these. I just think we don't have enough studies on these. And I'd avoid the chewables in particular because of the high sugar. Maybe take a calcium, most calcium supplements have vitamin D. Here we have magnesium and zinc. I don't think it's harmful. And then my last tip, and I'm going to save the last 5 minutes for questions, is to take vitamin D with a little bit of fat. And this is really true for any of your, it's really true for any of your fat-based vitamins. If you take vitamin D3 with nuts, seeds, hummus, olive oil, okay, even a little bit of butter, you're going to absorb it better. So I think I have a summary slide here. These are my top takeaways. You can read those, but let's open this up for questions. So, Roy, do we have any questions in the chat? I know we only have 5 minutes left, or this is time for people, if they do have questions, to ask them.
I don't see any questions in the chat. This is Steve.
I don't see any either.
Okay, well, then I'm going to ask you a question.
Yes, ma'am.
Um, let's see, somebody just typed something.
Yeah,
Have
we
you
have.
heard that soy consumption makes thyroid medications less effective? I have not heard that. I'm gonna actually make a note so I can research that, but I have not heard that. There was a lot of controversy about soy and breast cancer, but those studies have been pretty much debunked. What do you recommend for senior education on bone health? It's interesting, Connie. I do a lot of senior education. And I think it's really a combination of the things that we talked about. I think it needs to focus on nutrition, including what to avoid, like alcohol. It really needs to focus on movement and the variety of movement. And I think we need to also help seniors understand the role of functional movement. Let me just give you an example. People say, oh my gosh, I have to do strength training and cardio training and balance, and how can I do it? But even getting up and down out of a chair without using your arms is a really great way to improve strength, flexibility, and balance. Doing simple calf raises is balance, it's strength training, and it's also like mobility training, which helps prevent falls. So I think we need to think holistically, Connie. And then Ashley, does insurance cover DEXA scans? Is there an age limit? I don't know about the age limit. I'll give you a personal example. I had my first one at age 58 because I had bone health, foot surgery that didn't heal. And so I had a clinical reason for needing one. And my insurance has covered it ever since. And I get them every 2 years. If you don't have questions, what I'd love for you to do is type into the chat one thing you learned. Because I said that was my goal today, that everybody would take away one new thing. You can always say boron if there's nothing else, but take a moment. I'm curious if you learned something today. I'm hopeful. Yes, thank you, Jennifer. Balance training exercise, so important. Yeah, yeah. Your husband at 28 years old, calcium throughout the day. D3 with that. Well, these are great. These are great takeaways. Broccoli is just as good as kale. I love that one. Yeah, plant-based diet. Yeah, oxalates. Yeah, we don't talk about them a lot. So this is great. I know that you have another presentation starting in 1 minute. So I want to stop share. I'll turn this back to Roy. Thank you so much for inviting me today. Enjoy the rest of your summit. And thank you.
Thank you, Sally, so much for joining us. That was very, very informative.